Anyway, rates have gone up by 300%. So I got a couple things. These are actual figures of a Blue Cross plan. In 2013, for a child under age 18, premium was $51 a month. Now, 2016 is $166. A female 29 was 106, now 293. Male was 75, now 293. Used to, there was a difference between male and female rates. Now it's gender neutral, so that's why it's the same. And then female 49, 167 to 446. So about 300%. This is what's even crazier. Now you have to have maternity on everything. And so a couple, 49 years old, no maternity, was 303, now 892. With maternity, it's still double on there. And then you got a family age 49, no kids, no maternity, because heck, she's 49, she don't want any more kids. 404 versus 1224. So rates have gone up dramatically over the past 3 years. Why? You got a lot of sick people. Okay, so let's think about this. So what's happened is Obama's thing was we're going to make all these people have health insurance. And he did. He did a phenomenal job of that. But how did he do it? These poor people, they don't have any money. You know what they're paying for health insurance? Nothing. I mean, I've got clients. I've got one guy, he's making $12,000 a year, so his monthly premium is about $4, okay? His deductible is zero deductible. Maximum out of pocket is $550 because all that's subsidized, okay? So what's he going to do? He now has health insurance for the first time in 10 years. So where does he go January 2nd? He goes and sees Chip. And guess what? He gets his blood tested. He gets his PSA levels. He has a colon. I mean, he gets it all done. And guess what they figured out? He's probably sick because he hadn't gone to the doctor in 10 years. So now he's got medicine he's taking on a regular basis. He's got to go in for checkups and that type of thing. He's killing it. Had a lady come into my office 2 weeks ago. She's got approved for Social Security disability. She said, I just want to say thank you. I was like, for what? She said, oh, for getting me health insurance. I said, oh, that's nice. She said, do you realize that Blue Cross paid over $500,000 on me in the last 2 years? She hadn't had health insurance before it. She's sick as a dog. She's on disability now. She's sick. Her premium was $900 a month for 2 years. So we'll say $2,400 is what she paid Blue Cross. Blue Cross paid $500,000 for her, literally. I had another guy come into my office, 26 years old, hadn't had health insurance, can't afford it, doesn't make any money. He had some type of heart murmur, or I don't know, he had something wrong with him, it was pretty bad. He goes, so you mean I can get this and it's going to be effective in January with no pre-existing conditions? I said, yes. He goes, I've had the surgery that costs like $80,000 I've been needed done, I couldn't afford it. He got insurance. January 2nd, he had surgery scheduled. Saw him later in the year. You have it done? Oh, yeah, I had the surgery done. It was great. It's like a $100,000 bill. He only paid $8 a month for his health insurance because of his income. So he paid $8. Blue Cross paid $85,000. That's the why premiums have gone up. All these people. And then guess what? I've got another group of folks, and they're 22 years old. They're working blue-collar jobs. They're not making a ton of money. They don't want health insurance because they're healthy, so they're not paying any money into the pool. So you got a lot of sick people getting insurance now. You got a lot of healthy people paying the fine, so money's not going in. So what has to happen to the rates? They got to go through the roof to be actuarially sound. Did you hear about the co-ops? You hear Obama say, we're going to make these co-ops so there's more competition with health insurance. You know what? Half of the co-ops have gone bankrupt. I mean, I had a buddy of mine, I was talking to Michael, and I said, why didn't we form a co-op? He said, I tried. He said, I filled out every piece of paperwork you could figure out. He said, did everything you get co-ops. These co-op peoples got millions of dollars. They hired all these administrators and everything, paid them $200,000 or $300,000 a year. Went bankrupt 2 years later, said, oops, it didn't work out, and walked away from it. And that's what happened. These co-ops put the money, I mean, they charge nothing for their health insurance. Turned around, just got drilled, asked the federal government for money last year. Federal government gave them money last year. This year, federal government said, no, we're not going to give you another $100 million to stay afloat, and that's what they needed. So a lot of sick people, a lot of healthy people paying the fine. So we're seeing ridiculous rate increases. Okay, so I'm going to tell you secrets. This is top secret. 3 secrets your insurance agent doesn't know that can save you thousands of dollars. And I had a great example happen yesterday. Just idiots. There are a lot of idiots out there. They're doing this. Okay, number 1, we're going to show you how to hide money from the IRS and have them pay you or your employees. That's a nice one. Number 2, you need to create a mathematical matrix with multiple variables for comprehensive analysis of alternatives. I thought that was kind of neat. And then last, we're going to talk about considering options outside of the box. So the first thing is we got to learn to hide money from the IRS. How do we do that? Okay. Health savings accounts. With Obamacare, and I was talking to somebody this morning before I came. I thought I was supposed to speak at a company tomorrow morning, but they texted me this morning at 7 and said, "You're going to be here at 8, right?" I said, "No, it's tomorrow." He said, "No, we moved it up a day." Said, nice. Okay, so but anyway, we were talking, and the statistics for Obamacare, if you want it to look good, I can give you some nice statistics that look great. If you want it to look bad, I can give you some great statistics that look great, make it look terrible. Either way. But I was talking to a lady, and she said, "Well, I'm not eligible for tax credits." And I said, "Why not?" She said, "I make too much." I said, "How much do you make?" She said, $52,000 a year. Well, in order to get tax credits, you only got to make, as an individual, $45,000. So that is true. She's $7,000 above what she needs to make. But there's things that you can do to hide money from the IRS. Number 1 is IRA. I said, "Do you have an IRA?" She said, "Yeah, I put $100 a month into it." If she'll put $5,000-ish a year into that IRA, that's going to bring her income down to $47,000. If she'll set up a health savings account, she's single. Yeah, she's single. She can put $3,350 into the health savings account. Plus, she's over 55, so she can put another. So she can put $4,350 in there. So now we've got her income below $45,000. Her premium is going to drop $300 a month because of that. Okay, so by putting $7,000 into qualified taxable things, she's going to save $3,600 a year on her health insurance. So it's really only costing her $3,000 to do that, and it's not costing her because she's getting the money. So there's ways that you can hide money from the IRS, for lack of a better term, to help people out. Let's see. Hold on. I've got notes here. Okay. One thing I do want to mention, going back, Blue Cross's rates this year are about what United's and Humana's were last year. Humana and United took about a 5-10% rate increase this year. Blue Cross took between 30 and 50, depending on your plan. Blue Cross just didn't price it right, is what it boils down to. But they're still the most competitive around here. Okay. Now let's talk about this health savings account. It's doing 2 things. One, she's paying taxes on $52,000. So if we do math, if she's able to put $3,350 in there, and let's say she's at a 15% tax bracket, how much is she saving, Eric?
What was the question?
If she's putting $3,300 into a health savings account and she's in a 15% tax bracket, how much is she saving? Yeah, she's saving $500. So now it's only costing her $2,500 because of that. Then she can put another $1,000 in there, and we're better off. Now let's say you're self-employed. Is it okay? So if you can put that in there, does she get to deduct HSA off of her self-employment taxes?
No, not for self-employment.
Then scratch that. You don't need it. You can't do that.
You were until 2010, but they did away with that in 2010.
Another Obamacare law. But if you're a family, as a family, you can put $7,750 in there, okay? That's a lot of money. And if you're wealthy, it's even more. So health savings accounts are huge there. The thing that you got to look at, too, is what's health savings account eligible and what's not. Under Blue Cross, these 2 plans here are not health savings account eligible. This one is, and this one is, and this one is. But you got some that aren't. So you got to factor that in to figure out what makes the most sense, because you can dump money in and save some money there, okay? The other thing this does, it reduces your household income, so your subsidies actually are going to go up. So not only are you saving money on the HSA, but you're getting those subsidies as well. Okay, so subsidies. This is one of the things that they talk about is that Obama's put out, and I can't remember the statistic they said. I think he said 75%, well, actually said 92% of the people who are receiving subsidies are not going to see a rate increase in their health insurance. Well, it's true. You're paying health insurance based on your income. So if your income doesn't go up, your premium's not going up. Your subsidies go up. Well, these are the limits. Think about Tri-Cities region, Upper East Tennessee. A family of 5, husband, wife, 3 kids, or wife, 4 kids, whatever. Family of 5, if you make less than $111,640, you're eligible for tax credits. You think that's going to cover almost every family of 5 in the Tri-Cities region? Yeah. I mean, that's a lot of money that you can make and still get tax credits. So there's a lot of tax credits out there that people can have access to. But the problem that you get into is if the spouse works and is employed and has health insurance offered, the rest of the family is not eligible. And so what we're seeing a lot of times is, like, let's say you're married and you got 3 kids. The thing they used to say last year, you say, well, my husband's got health insurance through work and he pays $50 a paycheck, but it's going to cost $1,000 to add me and the kids. And we just can't afford it, so I got to go without health insurance. My answer, you say, what can I do? Well, get a divorce. If you'll get a divorce, live together, then you're actually eligible for tax credits now, because your spouse doesn't have it. You don't have a spouse, so he can't be eligible for health insurance. So that wasn't a good thing for me to tell people to do. I didn't like doing it. It kind of went against my morals. That was one of those things that we talked about, that Eric was talking about. It went against my morals. But I did have situations where people said, we've been living together for 8 years. If we get married, what happens? Well, you lose your tax credits, about $8,000 a year. And the guy always goes, well, I didn't want to marry her anyway. And the girl goes, I was wanting to get married next year. And so, I mean, it's kind of terrible that your morals do come into this issue. And I think, anyway, we'll go that later. But anyway, but what we're seeing a lot of companies doing is the company that your husband works for at this point in time and your 3 kids, they're not going to allow the spouse and the kids on there. Because even though they're offering, but as long as they're saying no dependents are allowed, we're now eligible for tax credits. And you're seeing more and more companies do that this year because it is affecting it. Okay, insurance premium caps. Okay, the more you make, the more you pay of your percentage of income, but notice that there is a cap. So with folks 50 and older, that cap can really, the difference between hitting the 400% of poverty level and 401% can be a huge difference. $400 or $500 a month in some situations.
Now that cap's for silver plan, right?
Well, what you get, okay, is you pay no more than this percentage of your income for the second lowest price silver plan, okay? Only when the sun comes up in the west on the 3rd Saturday in June. Now, I know it's convoluted, and that's about the way it works. But so basically, they're saying you pay. We have markers.
On the table, right behind you.
Okay. So if the price, the second lowest price silver plan, last year that was the second lowest price silver. Actually, that was that's this year. That's the second lowest price silver plan. So 733 is the price. If your tax credits say that you pay no more than, wrong way. If your tax credits say that you pay no more than 9% of your income and you make $35,000, you're paying no more than roughly $300 a month for this plan, okay? So that means that you have a $433 credit. I did my math right? Yes. Okay, so then you can apply that credit to any plan you'd like and move that. but that's the most that you have to pay for that plan. So if you get a more expensive plan, you still get the tax credit. If you get a least expensive plan, you might pay zero for your premium. Okay, so a family of four making $90,000 will pay no more than $724 a month for that plan, which is a good plan. Family of five making $81,000 will pay no more than $645 per month. But you can see, I mean, I've got folks, husband's the only one that works, mom stays home with 3 kids, and husband makes $35,000 a year. How they survive, I don't know, but they're doing it, and they can get health insurance for next to nothing for the whole family. And we're seeing that happen a lot. Okay, so that's my brother. No. I used him to create a mathematical matrix of multiple variables for comprehensive analysis of alternatives. You really got to do that because you can't say one plan's the best for everybody because it does depend on what they're doing and it depends from year to year. What I want to show is this, and this is what happened last year. This plan here, I was talking to a lady, sweet lady, nice lady, and then she had me talk to her husband, her son. I said, what plan you got? She showed me this one. Well, this plan here is a $3,500 deductible with a $3,500 max out of pocket. It means that the most they're going to pay is $3,500. After that, Blue Cross is going to pay everything. Done. Okay? It has some co-pays in there. So when you go see Chip, you pay $30. Okay? If you go see him as a specialist, it's $50. So there's co-pays, drug cards, that type of thing. But still, once everything's said and done, $3,500. That plan there, same thing. Maximum out of pocket is $3,500. Okay? You just don't get co-pays. You got to pay everything up to that point. You go see Chip, you pay $100. Okay? But here's the deal. Annual month, but your maximum out of pocket is only $13, and this one is $12,754. So I was talking to a couple last year, and she's diabetic, so she takes a $300 a month drug, and then she has to go for other stuff. Okay, so we were looking at it, and we ended up doing this one because she said, well, I don't want to pay that much a month. I said, but let's look at it all together. So you look at the premium plus your out-of-pocket max. She was only going to pay, and that was actually not quite the premium at 64 years old, but she was going to pay about $10,000 when all said and done. Where if we went to a higher deductible, she was going to end up paying a lot more because of her out-of-pocket max.
But how often do people really reach that max out-of-pocket? Because I mean, we've gone. I mean, I have four kids. We've gone 16 years without ever getting close to even our regular deductible.
And you might not, but
I mean, what's the percentage? I thought it was only like 20% ever reached that maximum. 20% of the insured only reached that maximum out-of-pocket each year.
well, the problem is people on Obamacare are hitting it because they're the ones that are buying it.
But see, those are the subsidized. That's what I'm saying.
But even
they're
those,
going to. But I'm talking about the people who are actually buying these plans to pay for it to subsidize those people.
if you're
Why not get something lower then and say, you know what, I may not use this for 6 years, so yeah, I pay $5,000 more out of pocket, but I'm really not. I'm saving $5,000 a year. So if I use it in 6 years, I've saved $30,000 to really put in another $5,000 if I reach my max out of pocket then.
because when you're taking 2 diabetic supplies per month.
Well, no, but it depends on the person.
Yeah.
Right. But I mean,
Yeah.
a normal family that's not diabetic. I mean, you have healthy people.
Generally speaking, yes.
Yeah, because I mean, I want to say the percentages that even Blue Cross Blue Shield posts it, like 20% reach their max out of pocket every year.
It's not great, but then you get idiots like me that do things like this, and
yeah,
you never know.
You'd be perfect for that with a routine coverage. You'd be perfect for that to do that and then just go get pay for a visit.
Correct.
Or join another plan that provides something like that.
Well, and that's why, and that's where you talk to folks about. I mean, you got to know, okay, am I going to have a baby this year? Am I going to have heart surgery this year?
Yeah.
Am I going to jump out of airplanes? Am I going to go free climbing in Patagonia? Needs to look. But bottom line, you got to look at your maximum out of pocket there, because the least expensive is not always the best if you have an idea of what it's going to be. Okay. I just like that picture a lot. Okay. Again, the Gold 8 is better off than here. Now, the thing that we got to look at though is this: what's HSA compatible? If my maximum out of pocket here is $17,000, here's 19, but I'm a family, I can put $6,000 in an HSA, and I'm in a 35% tax bracket. it's going to even up because I can't put any money in HSA there. I can dump it all in there, and then my tax savings have made it a wash.
And it rolls over every year, so
Yes.
you could have $40,000 sitting in an HSA account.
Exactly.
To cover anything, so it wouldn't even matter. Again, you wanna go with the lowest plan then, if you're a healthy family. Unless you
In
have
that situation,
diabetic,
yeah.
Some kind of seizure disorder,
Yeah.
Diabetes or something, heart disease,
Yeah.
something like that.
Were you going to ask a question?
I have a very specific question, and I would ask you separately, but
Okay.
Eric may know the answer on this. So we have a weird situation. My husband's in medical school, so we have borrowed for him to go to school. I own a business, and we have a foster child that we've had more than 6 months, so we can claim him, but we get income for taking him in. What if that counts as income? Like, I either made nothing this year, or I made like.
I was told that DC, because we're going through foster parenting classes right now.
Are you?
And I asked
You
her,
should talk to me.
and I asked her, and she said that the per diem amount that you get is not counted as adjusted towards your adjusted gross income for tax purposes.
And that's true. I've got a couple clients.
Okay.
That does not count. Yeah.
And loans don't count as income either.
That's what I thought. I just wasn't sure if it counted, it's Obama.
Yeah.
Sorry.
And that's why you gotta figure out how you want to shield money from the IRS. Okay, so moving on. So here's still at 15, but you're looking last year, that gold plan, generally speaking, if you knew you were going to have some health issues, that's what you wanted to go for. Now we got 2016. You look at this. Here's our premiums. Here's our premium dollars here. Lowest one's here. Our max out of pocket on this situation, family 3 in the 30s, is $18,000. This one's $16,400 and this one's $16,200. Well, again, you got to look at HSA compatibility. What are you dumping in there? What are you able to hide from the IRS legally? And then what are we looking at as far as worst case scenario? Like Chip says, you can roll the dice. You can go with that one, but if nothing happens, you're fine. But if you do have some bad stuff happen in your family, you end up paying $2,000 more from that one. So you got to look at your situation. But what we're still seeing a lot is people say, well, I want a copay. And so they'll go down to this one. And they'll pay $14,000 a year, $3,500 out of pocket, where they could save $8,000 a year and get a different plan and pay for most of their health insurance and then do some of the things we're going to talk about later.
And if you get the HSA plan, I mean, you make it through 2 or 3 years of saving your family HSA deduction. You're going to have, what, $10,000 in an account, so you're going to meet that extra anyway, so you might as well go with the cheaper plan.
Yeah, a lot of times. Now, we got premium caps here, so what I want you to see is this. A family of 4 making $90,000 will pay no more than $724 per month. So with some of these as well, like family of 5 in their 40s, family of 5 making $81,000, they're going to pay no more than $645 per month for health insurance. Well, family of 5, their premium for the second lowest plan, which is that one, $969, they're only paying $645, so they're going to save $300 a month off their health insurance. So they could get this plan for $367 a month, which is pretty cheap. And that's why Obama is saying health insurance is less expensive. But as we know from the first slides, these rates here, this plan here, for this family of 5 in their 20s would have been about $200 a month 3 years ago. Okay? So, think outside the box. A couple things. Number one, Simply Healthcare. I need help going to here. Simply Healthcare. This is Chip's business. Here. This is one of the neat things that's come out. Flyers, Chip. This is a neat thing that's come out here with Simply Healthcare. With Simply Healthcare, it's not going to take the place of health insurance for you, but the way it works is you pay $35 a month per person in your family with a cap, and then you can go to any of the participating clinics, pay $35, and you walk out the door. So if you're scared about having that $5,000 deductible, well, I can tell you, I've got a $5,000 deductible on my plan. My wife was weed eating a while back, cut her foot open. We didn't go to the emergency room. We're smarter than that. We went to a walk-in clinic. We still walked out at $285. Okay? That's where Simply Healthcare comes in. You can avoid a lot of those high-priced costs. My kids, 2 of them, were not feeling good because we have a $5,000 deductible. We don't go to the doctor that often. For 2 days, they weren't feeling good. We had some friends kids were sick and had strep, that type of thing, and they've been around them. So my wife says, take them to the doctor. I said, I'll buy them a pair of shoes before taking them to the doctor. It's a lot less expensive. We took them to the doctor. The doctor said, yeah, there's a bad virus going around. The kid's got a little virus. What do you do for a virus?
Supportive care,
Nothing.
nothing.
Okay.
Well, something, but nothing.
So, but you make them feel better.
Yeah.
But you don't give them an antibiotic.
Yeah.
You don't give them, okay, so they had a virus. So they were fine a week later. I wasn't. I got my bill to $140 for the doctor to say, they'll be better in 3 days with a virus.
But you knew it wasn't strep. You knew it wasn't bacterial.
I did. No, it wasn't.
You paid for it.
Yeah, but
You should have joined the plan, man.
well,
$35.
you didn't have it at the time.
Somebody even x-rayed your ankle for $35.
But that's what I'm getting at. So if you'll think about it and combine it with something like a Simply Healthcare, these options are becoming more and more relevant for the families that are thinking, well, how am I going to afford a $5,000 deductible? I can't. My kids go to the doctor for a snuffy nose. I can't shell out $200, and a lot of folks can't. So the Simply Healthcare is a great idea with it. And then a lot of people are going to the concierge medicine, which is another thing that you'll have where you pay a fee and you can call Chip 24 hours a day, 7 days a week, and he's going to tell you what's going on. Or someone else but you have a lot of those things going on. The next thing that is out there that is interesting is this. It's called Doc on the Phone, Teledoc. The way it works is you pay $15 a month for your whole family, and you pick up the phone and you call a 1-800 number. Then they call you back. They have your electronic health records. Somehow they get them. I don't know how that works. It goes through the interweb. And you can Skype with them or do it. They're going to call you in a prescription for an upper respiratory infection, ear infection, eye infection, urinary tract infection, that type of thing. No major stuff, but you can do it. You get the prescription, you're done, no copays. And so a lot of folks are doing this or Simply Health or both to try to ease the pain of the middle ground. I mean, if you have a heart attack and you're going into the emergency room, you're there, it's $200,000. And so you're going to use your health insurance for that. But for your smaller stuff, you can still use HSA money to pay for the bills, not the premiums. Premiums? Not the premiums on those, but for the bills. So your copays. But no.
I'm pretty sure that does not.
You can't pay for. No, I don't think so. But that's another option as well, and a lot of folks are going to that. And you're even seeing on your larger groups, Blue Cross will actually throw this in now. So if you're a large group, if you're an Eastman, that type of thing, you're going to start to see, hey, we now have a teledoc option. If you're with these national companies, they're doing it. And it's kind of interesting, and I'm going off on a tangent, but this is interesting. Because what happens when they come to CHIP, when Blue Cross comes to CHIP, they say, hey, CHIP, we need to renegotiate our rates this year. And they say, we have this many people in our group, and we want to pay you this much. And you say, well, what about teledoc? And they say, what about teledoc? You say, well, I'm going to have a reduction of who's coming in because you're using teledoc. So I need more per patient. I'm not going to give you the rate that we were charging you last year to come in. We want to negotiate a rate a little bit higher. And so it's a back and forth because it helps the employee because they don't have to wait in line, that type of thing. A lot of them are making them pay a copay for use of the teledoc. That's considered a copay, so they got to pay that. So it's neat because the doctors need the volume coming in their office to make up for the negotiated discounts that are doing with health insurance companies, but on the flip side, we're wanting to do the teledoc option. So it's going to be neat how it evolves, which is going to increase health insurance premiums going forward.
There's limitations on teledoc. I mean, obviously they can't touch and feel and look at things, and you don't want someone to just prescribe an antibiotic if you don't need it. You don't want your kids to be put on a drug and kill everything in their body and become resistant and not have it work in the future if they don't need it. So you're hoping that that's what's going to happen. And most of the time they're pretty reasonable with viral things too, listening to the history, looking at the person, that kind of stuff, and so forth. But this kind of thing actually would help our deal, because it would keep people from coming in unless they really need something, They really are sure, they're not certain if they might have a true strep, they need to have a strep test, they need to have blood work, they need to have an x-ray, or they just need someone to put their hands on them, to really look at them. So, it's kind of good and bad with us, in this.
What about the, like, we were just in New York last weekend, and on the subway, probably 50% of the ads are for the video consultations with doctors. And so it's got,
Same as that.
okay.
That's pretty much what that is. Again, it's a video, so you can't touch, feel, but you can still look and.
Right. Yeah, because that was showing like people, like one guy falling, and so he was in stitch or something, but he was showing the doctor and contact, and the doctor was talking him through what to do.
Or let you know, hey, you have to go get this fixed or not, which is another good application, because you can check, I'm not sure if my kid needs stitches or not, and you get on there, and it's essentially a free visit, 16 bucks a month or whatever it is,
and you use your phone. I mean, they'll do video conferences with you. You can go and, I don't know.
Yeah, you can do some of that stuff, which.
Who knows if they can see well. Black bag doc, everybody's heard that around here. They have signs, but Simply Healthcare is doing the same thing. The concierge medicine. You have one person you call. You don't have to wait. It's nice for busy people. And the last one everybody asked me about, are there any other options out there? Right now, Blue Cross is the most competitive in Upper East Tennessee. Not going to get any better pricing. Avoiding the fine. You do have like these share ministries, and those are legitimate. They are less expensive, but if you have any pre-existings, they're not going to cover it at all. So if you're obese, probably not going to cover you. You smoke, that's not allowed. You drink it all, that's not allowed. You have to attend church, and they're not going to cover anything that is morally reprehensible. So there are issues there. You have it for a family. Your kid goes and gets drunk, has a car wreck, and is in the hospital. Not going to cover it. They smoke marijuana, have a wreck, not going to cover it. They smoke tobacco, have a wreck, not going to cover it because they're using tobacco. That's morally reprehensible. My concern with them, though, is it's not insurance. So you have no guarantee that if you have a large claim that they're going to be able to afford to pay it. We've got a friend of ours who is with Eastman. Eastman had a cap before Obamacare of $2 or $5 million lifetime. The kid hit it at age 6. He just been, you name it, he's been in hospital basically his entire life. And Eastman said, you know what, don't worry about it. Whatever the bill will pay. And they legally have to do it now because of Obamacare. You just never know when a bill is going to go up that high. And with those, since it's not health insurance, they don't have a backstop. And so you just don't know. And if you've got, if you've got money, I've had people that are making good money, $200,000, $300,000, $400,000, $500,000 a year, saying, I don't want to pay for health insurance. I don't like Obamacare. I want to do this. I said, that's fine, but are you willing to stake your $4 or $5 million retirement, house, everything else, on a company that literally cannot have a backbone? It's only supported by other members.
See, those are the folks that benefit from the lower plan, just saying, just in case I have a catastrophic, to me it's crazy not to have a catastrophic plan like that. You can get one pretty reasonably, but you're going to have a little bit higher out of pocket, but again, you're not going to use it anyway.
Yeah.
Black bag is good. Black bag's more primary care.
Yeah.
And it's it's an individual or two that go, house to house or location to location, so they don't have several sites to go to. They don't do x-ray. They'll send labs off and that kind of stuff, so they definitely have a place. The folks are really good folks. It's sort of competition, but not really competition. And all I can do is speak well about him because he's a really, really good guy and he's very creative, but really good service. And so if we have someone who has primary care stuff, and then we're about to get primary care doctors also who will see him for the same price, see our patients for the same price, who have regular conditions, who need their glucose is checked, need some diabetes care, thyroid pop, whatever, they just go and follow up them. They pay the same price, and then we'll pay them.
Yeah.
And so it's kind of cool stuff. To me, it's exciting to see. I love business, and I love the fact that we can help contribute to changing healthcare in some way, and hopefully make a difference. It just has to have traction. We have to generate volume in order to make it work, and in order for it to be inexpensive for everyone. Because those $35 visits that's not the cost that the clinics charge us. They obviously charge us more. We're generating an income to hopefully pay for that. And so you need volume, both sides. Both. I'm sure his is the same way. Black Bag. I haven't really talked to him much, but
Yeah.
anyway.
But so there's options out there. Going forward, what do I think is going to happen? My personal opinion, I think that Blue Cross's rates where they are now are adequate. Last year they lost $386 million in their individual health insurance book of business, something like that. They lost a ton of money. I think those rates are where they need to be. I think that the sick people that needed the health coverage all jumped on the first 2 years. So I think you're going to see less of those shock claims. And so I think it's going to go down to, you're going to see your normal health insurance increases, which is 10 to 20%. But you're not going to see the 20. So I think it'll stabilize going forward, but you're going to continue to see the deductibles increase as much as the law allows, and you're going to continue to see pricing increases, which is going to lead to more folks using the Simply Healthcare, the doc on the phone, those types of things, and medicine has to just become more efficient. I think you're going to see a lot of folks like Chip are going to say, I'm going to get out of this, and it's going to be a cash basis. I'm not going to take any insurance. You come, you pay me a cash thing, and then walk out, no insurance, done. And that way they can get out of a lot of the government regulation as well, because it costs a lot for Chip to be able to comply with electronic medical records and all the junk they got to do. And a lot of times they just say, hey, I'll be open 8 to 5. You come and see me, pay me $60 and walk away and be done with it.
See, that's the other beauty too. Sorry to interject here. The other beauty of this is it's a set fee, so you know what you're going to pay.
Yeah.
I mean, that's the thing. There's a guy in Greenville, and we have an office in Greenville, who is a great guy also, and really cool stuff. He charges out of pocket. He's a just pay for service kind of thing, and just pay it up. Really great idea. He's been doing it for years. He's reasonable, but it's still not set. Depending on what you have done, you add to the, it's an a la carte. You just keep adding to it. We wanted to do something that was easy and simple. You go in, you pay this. This is what it is. So, but yeah, that kind of way is coming.
Have you heard if Farm Bureau is going to comply or not? If they're going to.
They comply. They're 20% above Blue Cross's rates.
But they are compliant now.
No, they're new plans.
For 16.
They have new plans that are not. They're selling both plans. They're selling compliant plans and non-compliant plans. Their compliant plans are, when I went on there and looked at rates, were about 20% higher than Blue Cross's. Their non-compliant plans are about half the price of Blue Cross's. But if you take a non-compliant plan, you're paying the fine. The fine this year is the greater of $695 per person for adult, half of that for each kid, or 2.5% of your household income, whichever is greater. So it can be a pretty hefty fine.
What makes it compliant?
Has to have the essential health benefits and be filed, approved by CMS.
Well, don't they still have a lifetime cap on their old plans too?
They've got a lifetime cap. They don't include maternity, and they don't include free well visits.
So like grandfather in plans,
Yeah.
Because that's who we have. I think we pay $400 a month, and we have a $5,000 deductible.
Yeah. So.
The lifetime cap is a big thing people don't see. I mean, because you don't think about it, but if you hit that $1 million, is it still $1 million? I know it was $1 million at one point.
But the thing is if you're getting close to that cap, you just January 1 switch to this, and I mean that's the thing. You're sick. I mean, I've got a girl, and I'll leave on this. Girl, she's 19 years old, 20 years old. She works at, she's a bartender. And she told me, I've got cervical cancer. What can I do? I said, well, get on Obamacare. She said, I couldn't. Why not? She said, I kept getting kicked off. You've got to make $11,700 a year. She makes 10. I said, what did you put for your income? She goes, well, I put 10,000, that's what I make. I said, can you get a second job or work a few more hours to get $12,000 next year? She said, yeah, not a problem. I can work a couple extra hours. If she just get 12,000, she would have had coverage, and it would have cost her all of $2 a month. She's got cervical cancer. She can't do anything until January 1 because she can't afford it. Cover the TennCare is only going to cover a little bit of what she's got, not everything. So she's stuck. And she said, well, I thought it was going to cost me a fee to come and see you. I said, no, we get paid nothing, just like everybody does with Obamacare now. No, I mean, so we get paid a commission for people we sign up. And so that's the thing. I mean, you got folks, a change of income, and let me go back to one more slide. A change of income on these things, your premium, if your income is between 100 and 150%, they give you a deduction on your deductible. If it's between 150 and 200%, they give you a discount on your deductible. If it's between 200 and 250%, they give you a discount on your deductible. Well, I've seen people put in, as an individual, they'll put in $18,000 of income when they really don't know what they're making. Well, you put in $18,000 of income, and now you're at 200% of federal poverty level. So your deductible is now $1,000, and your maximum out of pocket is $2,900. If they had put $17,000, their deductible would have been zero, and their out of pocket $1,450. Just because they didn't know enough to put the right amount down for their income, because it's an estimate. Federal government says estimate to the best of your knowledge. Okay? And so we see a lot of that happen. And
Wouldn't let her do it because she didn't make enough money?
yes, she put down 10,000 and she had to make at least 11,670. If you make too little money, you don't get any premium discounts. And so she was going to have to pay $185 a month for health insurance. She said, I can't afford $185 a month. I only make $10,000 a year.
Because they're trying to direct them to Medicaid, but Medicaid hasn't really been expanding, so a lot of people can't even get on that. So that's the problem. Those are the people that are theoretically supposed to be signing up for Medicaid.
And Tennessee hadn't expanded Medicaid, so they can't in Tennessee.
And even if they get it, they usually can't get them to see a doctor.
Yeah, because the network's really thin. So, yes, and so you have issues like that come up all the time. I mean, bottom line, you need to make sure you deal with someone who knows what they're doing. I mean, we've done, I think we're at 200, almost 300 of these, which that makes us one of the largest, if not the largest person in the Tri-Cities region that's doing individual health insurance. So we know what we're doing off the top of our head, and it's frustrating when I run across folks like I saw yesterday that paid an extra $5,000 last year for absolutely nothing. So, questions? All done. Now, how do I turn this off?